Hi, my name is Dr. R.M. Lalita and I am an oral and maxillofacial surgeon by profession. What is oral and maxillofacial surgery? Oral and maxillofacial surgery is a vital branch in dentistry that links the medical profession and dental profession in a hospital setup. Maxillofacial Surgeons Day is celebrated all over the world on February 13th. February 13th marks an Oral and Maxillofacial Surgeons Day. So today I want to highlight the importance of maxillofacial surgery. Maxillofacial surgery is basically a post graduation in dentistry after BDS. The students tend to pursue this course out of the interest gathered by seeing their seniors and famous personnel in this field. They have left a lasting impression on the upcoming graduates. Oral and maxillofacial surgery is basically divided into oral surgery and maxillofacial surgery. Basically, these are the minor oral surgeries and the major oral surgeries. Minor surgeries are done under local anesthesia in a OPD setup. What are the minor surgeries done under local anesthesia in the outpatient? The first one to be counted is the extraction of teeth. All of you must have experienced extraction of teeth with a jab in your mouth. So extraction or exodontia is the first step in oral surgery. Other minor surgeries include removal or extraction of impacted tooth or the wisdom tooth, suturing of the soft tissues of the jaws, wiring of the teeth or splinting of teeth when it is injured, and then excision of cysts in the soft tissues, excision of minor tumors in the jaw and mouth, excision of soft tissue tumors in the mouth which are easily accessible and small in size. Sometimes, to add to the local anesthesia, we also give sedation like nitrous oxide sedation, and sometimes we use IV sedation, of course. What are the branches that are carried out under the major oral and maxillofacial surgery? The first branch in oral and maxillofacial surgery is the maxillofacial trauma. All of you must have heard about maxillofacial trauma, that is fractures of the jaws. Fracture of the jaws can be treated under the hospital setup, and this is usually included in the maxillofacial surgery. For example, it may be the maxilla fracture or the mandible fracture or the cheekbone or the zygomatic bone fracture or the nasal bone fracture. So these oral and maxillofacial surgeons are basically trained to do oral and maxillofacial surgery under general anesthesia. The next step is the treatment of oral cancer. Oral cancer is one of the major branches coming up in the form of oral oncology. Oral oncology deals with surgical removal of the cancerous part of the oral cavity. So we do team up with surgical oncologists, radiation oncologists, and chemotherapists to treat oral cancers. And then we have surgery of the maxillary sinus, surgery of the temporomandibular joint or the TMJ, and also surgical removal or surgical excision of tumors of the jaw bones and cysts of jaw bones, And one more major branch is the treatment of acquired deformities of the face, wherein the symmetry of the face is corrected in the form of orthognathic surgery. Some defects are by birth, and these are clefts of the lip and palate. So, treatment of cleft lip and palate is also a major part of oral and maxillofacial surgery. Every hospital should be provided with the services of an oral and maxillofacial surgeon, because an oral and maxillofacial surgeon is aptly trained to deal with the emergencies of the face and mouth. So he can be included in the team of surgeons, and he can correct the defects of the face and jaws correctly in time. So oral and maxillofacial surgery is aptly supported by the technology like CT scan, MRI and CBCT and rapid prototyping. All over the world, the upcoming branch of oral and maxillofacial surgery is very well established, and India also is a pioneer in oral and maxillofacial surgery. Many oral and maxillofacial surgeons have brought up this specialty for more than half decade. So today it is our duty to create awareness about oral and maxillofacial surgery, and in doing so we help the common man to understand what is oral and maxillofacial surgery and when to consult an oral and maxillofacial surgery. Thank you. All the best.